Good morning. You're watching DD News and I'm Preeti presenting this special edition tracking COVID-19, wherein we apprise you with all the developments on the pandemic. Even as the cases of the pandemic continue to spiral up globally and domestically, the Indian government has come to the rescue of the Indians stranded abroad due to COVID-19 restrictions with Vande Bharat mission. We get you more on this. Also, we'll get you international updates, also inputs from the reporters and also other aspects of the pandemic. Stay with us for the next half an hour. We start with the headlines first. India's largest repatriation exercise, Vande Bharat mission underway. Today, first flight carrying medical students going to Srinagar from Dhaka. Students express happiness to Indian High Commission for evacuating them in this crisis. INS Jalashwa bringing home fellow countrymen stranded in Maldives through the sea route. Union Health Minister launches Ayush Sanjeevani app and interdisciplinary studies involving Ayush interventions for COVID-19. The alliance between technology stakeholders will help the traditional knowledge of Ayush to reach a large number of global population. Union Health Minister Dr. Harshvardhan reviews preparedness containment measures taken for COVID-19 management in Uttar Pradesh, Odisha and West Bengal. Stresses that states need to ensure adoption of infection prevention and control practices in all healthcare settings to avoid and reduce the chances of infections to healthcare workers. In the ongoing COVID-19 outbreak, total active cases of COVID-19 rise to 37,916, 16,539 patients cured and discharged in India. Death toll due to the pandemic reaches 1,886. Coronavirus cases across the world rise over 38 lakh with over 2,69,000 deaths reported so far. US worst hit as COVID-19 cases cross 75,000 mark. Britain records more than 30,600 COVID-19 deaths. France records a fall in COVID-19 deaths, gradual and phasing of the lockdown to begin from 11th of May, borders to remain closed till 15 June. Those were the headlines. First, we'll take stock of the developments in India in our segment Ground Zero. Let's begin with the latest numbers of COVID-19 cases from across the country. The total number of confirmed cases is now 56,342. Out of these, active cases of COVID-19 across the country stand at 37,916. A total of 16,539 people have been cured or discharged so far. A total of 1,886 people have lost their lives. And up next, we'll get you the current status of the COVID-19 situation from the worst hit states in the country. When we go across to the map, we will get you the states. Here we have Maharashtra, that is the worst affected state. And in Maharashtra, the total number of cases is 17,974. Out of these, 13,979 are the active cases. 3,301 recoveries have been made and 694 are the fatalities. So the state of Maharashtra there, the statistical data on your screens. The next state is Gujarat. The confirmed cases are 7,012. Out of these, 4,878 are the active cases and 1,709 are the recoveries made, which means this is the number of the people who have completely recovered from the illness or they have been discharged from the hospitals, and 425 people have lost their lives in the state of Gujarat. From here we go across to the capital, national capital Delhi. In Delhi, 5,980 are the confirmed cases. Out of these, 3,983 are the active cases. 1,931 recoveries have been made, but there are 66 people who have lost their lives in the national capital. After this, we go across to down south, Tamil Nadu. In Tamil Nadu, the total cases which have been reported is 5,409. Out of these, 3,825 are the active cases, 37 are the fatalities, and 1,547 are the recoveries which have been reported from the state. After this, the next state we pick is Rajasthan. In Rajasthan, 3,427 are the confirmed cases. Out of these, active cases are 1,734. 97 are the fatalities, and 1,596 have been the recoveries which have been made. So when we talk of the current situation in the country, these were the first 5 affected states in our country. But again, the main point is to ensure that you take care of yourselves. You have to follow the guidelines, make sure you follow the norms of social distancing, keep yourself isolated, and also maintain personal hygiene. These are the precautions, and remember, precautions are the best way to keep COVID-19 at bay. Let's get to other news. 2 special flights from the UAE carrying a total of 354 Indian nationals, including 9 infants, reached Kerala on Thursday night as India began its biggest ever repatriation exercise to bring back its citizens stranded abroad amidst the COVID-19 induced travel restrictions. The first Air India Express flight carrying 177 passengers from Abu Dhabi landed in Kochi. Later, Dubai Kozhikode flight brought back many nationals as part of the massive repatriation exercise named Vande Bharat mission. Now, there are no suspected COVID-19 cases among the first batch of passengers being repatriated on Thursday, as all of them have cleared the tests. The criteria of passengers selection included medical cases, loss of jobs, pregnant women, and senior citizens. On Monday, the Indian government announced plans to begin a phased repatriation of its citizens stranded abroad from May 7th. The government also said that Air India will operate 64 flights from May 7th to May 13th to bring back around 15,000 Indian nationals stranded abroad due to the lockdown. The Indian missions in the United Arab Emirates finalized the list of passengers who were chosen based on the compelling reasons they submitted while registering their names. The Air India crew members on board the repatriation flights were donning the full range of personal protective equipment.
The moment I registered in Indian Embassy, all the officials, they had called us repeatedly, and follow-ups have been done beautifully, and they all supported us in all the ways.
And the first flight to bring back the stranded Indians from Dhaka to Srinagar will leave at 11 a.m. today. The flight will carry 167 medical students from Srinagar studying in Dhaka. The students have expressed their gratitude to the central government and the embassy for evacuating them during this tough time.
The embassy, the Indian embassy, they did a good job actually. We had to do an online registration for that firstly, and then they sent us the emails accordingly, and we had to book our tickets. So they did a good job, really good job actually.
Under the Vande Bharat mission, Indian Navy's INS Jalashwa, which sailed to Maldives for evacuating stranded Indian nationals, will start for Kochi today with evacuee Indians. INS Jalashwa, with the capacity to generate 3 megawatt of electrical power, 60,000 gallons of fresh water a day and extensive medical facilities, is ideally suited to undertake humanitarian assistance and disaster relief missions. In the event of the Indian nationals returning from abroad, the Ministry of Health and Family Welfare has issued guidelines for home quarantine of contacts and home isolation of patients who have requisite accommodation at home for self-isolation. The ministry has informed that there are a large number of facilities such as hotels, service apartments, lodges which remain unoccupied due to the impact of COVID-19 on travel and tourism. There are also instances where people who do not have requisite space at home may opt for such facilities. Now, this is likely to reduce the pressure on the family, give comfort to the person, and also protect the family members and immediate neighborhood. Union Health Minister Dr. Harshvardhan reviewed the preparations and containment measures taken for COVID-19 management in Uttar Pradesh, Odisha and West Bengal through video conferencing on Thursday. At the outset, Dr. Harshvardhan appreciated the dedication of all the states in combating COVID-19 pandemic in the country. He said that India is in a better condition as the fatality rate is 3.3%. and the recovery rate is 28.83%. He said that the testing capacity has increased in the country and it is 95,000 tests per day with 327 government labs and 118 private labs. Cumulatively, 13,57,442 tests have been done so far for COVID-19. Dr. Harshvardhan stated that states need to focus on more effective surveillance, contact tracing and early diagnosis to keep the fatality rate low. In view of the surge in number of migrant laborers expected to reach the states in the days to come, the Health Minister exhorted the states on the need to increase sampling and testing of the cases along with proper quarantine arrangements of the migrant workers. Dr. Harshvardhan also suggested that along with the surveillance teams in the containment areas, community volunteers may also be identified at the ward level to spread awareness about the preventive measures. Union Health Minister Dr. Harshvardhan on Thursday launched the Ayush Sanjeevani app and 2 Ayush-based studies related to COVID-19 situation in the presence of Minister of State for Ayush, Independent Charge and also Defence, Shripad Yeso Nayak, who participated through video conferencing from Goa on May 7th, 2020. Our correspondent Yogesh Sheetal takes stock of the situation at Ardhar Road Prison in view of the COVID outbreak in Mumbai.
As a report of COVID-19 outbreak in Ardhar Road Jail, one of the oldest and one of the most congested prisons in Mumbai, has surfaced. The government of Maharashtra has started shifting all COVID-19 victims from Ardhar Road Jail to different isolation centers. Meanwhile, many lawyers have said that they have started receiving calls from their clients just to know about the status of their relatives who are locked in the jail. There are around 60 prisons in the Maharashtra and almost all prisons are completely congested and it is impossible for them, for the prisoners to maintain social distancing, and that's the reason many of the prisoners want to file parole and want to file a bail application, and they want their plea to be heard on urgent basis. There are around 17,974 COVID positive cases in Maharashtra as of now, out of which 1,216 new cases. In Mumbai, talking precisely, there are around 11,219 positive cases, out of which 692 fresh cases have been reported. A total of 694 deaths have been reported in Maharashtra as of now, out of which 437 new deaths have been reported. So the numbers in Maharashtra are going up, and we are getting the reports that earlier we had seen that some police officials in JJ Police Marg Thana, they have found positive. Now the pandemic have started outbreaking in the prisons. So these are the latest concerns that Maharashtra government is facing right now. With my colleague Yogesh Kumar Sheetal reporting for DD News and DD India.
And even during these times of crisis, news filled with goodness is coming in from across the country. Up next, we'll take a look at some of these reports in our segment Good News. With rising demand for face masks to contain the transmission of COVID-19, an IIT Delhi startup has come up with washable face masks that can be reused up to 50 launderings. Triple lead mask has 99.2% bacterial filtration efficiency. Take a look.
If you want to protect yourself and others from the coronavirus, the use of a mask is important. Amid such rising need, single-use masks are certainly leaving a hole in many pockets, while having disposable issues too. Considering that, a startup of IIT Delhi has made a face mask which is cheap, washable and can be reused 50 times. Ex-IITian Anusuya Roy and her team has made an antimicrobial and washable face mask named N-Safe.
It is very easy to maintain it. After each usage, wash it with cold water and mild detergent and put it outside in direct air or sunlight to dry. After drying, put it in a hygienic place to store.
The fabric-based antimicrobial N-Safe mask has very high bacterial filtration efficiency and is engineered to have a very good breathability and comfort.
This is the mask. There is a wire in the nose region and there is an elastic band in the chin region. This too will ensure that I have a good fit with the face, which is a very important parameter while choosing masks.
After using the N-Safe mask for 8 to 9 hours, one needs to wash it with detergent and cold water and then dry it in the sun. The cost of the pack of 2 N-Safe masks is 299 rupees, while it is 589 rupees for a pack of 4. Nishant Saurabh's report, DD India.
COVID-19 has turned the tide on most business enterprises. Amidst the pandemic, Subir Saha, a petrol pump owner from Asansol in West Burdwan, is in the news for all the right reasons. He has taken a slew of measures to ensure that business goes as usual. For maintaining social distancing at the pump, a long drawn tube is attached onto the fuel dispenser to maintain sufficient space between staff and the customers. Since the lockdown started, social distancing is compulsorily maintained between the buyers. The incoming vehicles are thoroughly sanitized. For bill settlement, a plastic cash box is used to ensure that sufficient distance is maintained. For digital transactions, a swipe machine is used, which is being sanitized every 45 minutes. Besides the above, petrol and diesel are being transported free of cost to small-scale industries nearby, helping them plod through the difficult times.
फ्यूल एट डोर स्टेप कंसेप्ट है। ये हमारे माननीय मिनिस्ट्री ऑफ पेट्रोलियम के जो मंत्री जी हैं उनके कंसेप्ट को साकार किया गया है ताकि हर एमएसएमई जहां बल्क डीजल की रिक्वायरमेंट आती है वहां पर जनरेटर्स वगैरह में पहुंचाया जाए। इससे बहुत सारे फायदे हैं।
And up next, we get you the way we check the facts behind some viral information, and in this segment we get you the myths and we check them. And Prasar Bharati News Services has done a fact check where in Hyderabad edition of a national daily reported 50,000 COVID-19 deaths in India, while the actual figure stands at 1,783 as on May 7th, 2020 at 8 a.m. as per the Union Ministry of Health and Family Welfare. Now, the Hyderabad print edition of the newspaper has sincerely regretted for the error and subsequently corrected it. And up next, we'll scan through the developments from across the globe in our segment World Wrap. U.S. House of Representatives Speaker Nancy Pelosi on Thursday laid out the broad outlines of the next massive COVID-19 response bill. Pelosi said that the bill's major components will include additional aid to the state and local governments, more money for coronavirus testing, and also help for the financially troubled U.S. Postal Service. Without providing details, she also discussed the need for putting money in people's pockets and direct payments. The House is expected to vote on the coronavirus rescue bill next week. In Mexico, at least 47 residents and 3 workers have been infected with COVID-19 at a retirement home in the northern state of Nuevo Leon. Now, this is one of the biggest outbreaks yet reported in the country. According to the Nuevo Leon health minister, condition of all the 50 who tested positive was stable. Authorities believe that the virus could have spread from a cook who worked at the home. Mexico has so far registered 27,634 cases of COVID-19 and 2,704 deaths. Nuevo Leon, which borders the United States, has reported 909 cases and 29 fatalities. Norway announced plans to reopen large parts of the Scandinavian country in the next few weeks as it seeks to return to normalcy after the lockdown. The entire school system in Norway will reopen from Monday. Bars and amusement parks could reopen on June 1st, while private gatherings of 20 people rather than 5 will be allowed. The government also aims to allow the Norwegian Football League to resume on June 16th and planned events with up to 200 participants one day earlier. However, foreigners without the right to live or work in the country are still not allowed to enter the country. The Nordic country was one of the first in Europe to curb activities to rein in the spread of novel coronavirus on March 12th and to relax some restrictions once it got the outbreak under control in late April. And giving and distributing food is one example of how people around the world are adjusting to the strain the COVID-19 pandemic has put on the supply chains. With unemployment soaring, demand from food banks is also rising fast. At the same time, farmers have fewer outlets to sell their crops, with restaurants closed or offering limited menus. In Western Washington, hundreds of drivers pulled over their vehicles to pick up free russet potatoes. Around 90% of Washington potatoes are processed for food service, nearly half of the international price markets. Now, potato producers in Europe have also faced enormous surpluses. The coronavirus pandemic so far has infected more than 1.2 million people in the United States and has killed around 74,000. And French Prime Minister has announced that France is ready to start unwinding its COVID-19 lockdown from Monday as planned. The French Prime Minister said that measures to curb the spread of COVID-19 will be kept in place in Paris when the lockdown is eased in other parts of the nation. Primary schools and most businesses will be allowed to reopen from Monday, while cafes, restaurants and secondary schools will remain closed till further notice. But for the first time since the lockdown began, people can go back to work and leave home without downloading a permit. However, countries' borders would remain closed until further notice. The government has issued a color-coded map of the country, splitting it into green and red areas depending on the rate of infection. Restrictions will be eased more in the green areas than the red for the time being. And Russian military medics bid farewell to their Italian colleagues after traveling to Italy to help at the front line of the coronavirus crisis. Russia began sending doctors, nurses and medical equipment to disease-stricken Italy in late March in a goodwill operation that Moscow dubbed as From Russia with Love. Their tasks included disinfecting medical facilities and treating COVID-19 patients. Italy has been one of the worst hit countries since the outbreak came to light, with death toll topping 29,900. This is the third highest in the world after the United States and Britain. And lip reading suddenly got tricky when everyone covered their face during the coronavirus pandemic. But Indonesian tailors have hit upon the perfect solution: see-through masks. Faizan Badruddin, who was born with total hearing loss, decided to adapt the traditional cloth mask along with her husband, Imam Saroso, who was also deaf, from their humble tailoring workshop in Makassar on Indonesia's Sulawesi Island. The couple started producing cloth masks with transparent plastic in the middle to help fellow deaf people. The couple can make up to 20 masks each day, and so far they have sold around 200 masks. They have supplied to buyers across Indonesia, including the capital city Jakarta and the resort island of Bali. Such invention has become a blessing in disguise for many in Indonesia. And up next, we get to a video on Arogya Setu app, which addresses privacy concerns. We assure our viewers that this app is completely safe and addresses the well-being of all our citizens. With that, take a look at this video. We'll take your leave. Bye-bye.
Hi, how are you?
I'm doing good and fulfilling my duty of responsible citizen by staying at home to maintain social distancing.
Yeah, me too. Actually, I have a few doubts about the Arogya Setu app. After installing this app, what all personal information are we required to share?
When you are registering on the app, it will ask you for your name, age, gender, profession, and your last 30 days of travel history. It would also request for permission to keep mobiles, Bluetooth and GPS location on.
So where does all this information go and get stored?
The information submitted by you is encrypted and safely stored in the server.
So information about me like where I go, with whom I meet, is also being stored in the servers?
No, if you come in contact with another person who has also installed the same app, this piece of information is captured and stored on your mobile itself. This information is not sent to the server.
Okay, so this information does not go outside my phone.
No, it does not. This information is only sent out of your mobile to the servers if you are found to be COVID positive.
Understood. If I become COVID positive, then this information is used to inform everyone who knowingly or unknowingly came in contact with me so that they can also get themselves tested.
That's correct. If you remain well, then even the government will not use this information. Your personal information will remain personal and secure within your mobile.
Will information about me be stored permanently in mobile or servers?
No, that's not the case. The captured information gets deleted from your mobile after 30 days and from the server after 45 days. In case you are found COVID positive, your information from the server will be deleted after 60 days.
This is great. This app keeps my data safe and private, and I am safe as well. I'm convinced now that Arogya Setu app is the right way to fight Corona.